Hi, everyone. Thank you for taking this time to come and be part of us as we go through this OET presentation. This is a presentation for a sub-test that's on the OET. And so as you may be aware, OET is an occupational English test. It is a test that is administered specifically for medical professionals. Currently, it is offered for doctors, for nurses, and it's expanding. And so this evening, we want to just spend time on the sub-test, on the speaking aspect of that test. And we'll talk about the role play that is conducted in the OET speaking test. And so just an overview of what role play is. I'm sure many people would wonder, what do we mean when we mention role play in the OET speaking test? What are we talking about? And so essentially, it's a scenario where a candidate gets to play the role of a medical professional. And you are interacting either with a patient or with a non-medical individual, and you will have to explain certain concepts, go through certain scenarios with them. And so essentially, role play is you are in a scenario, there is an issue at hand, and there are certain tasks that you will have to go through, play your role properly. Now, in this test, you would go through two roles. During the actual OET speaking test, you go through two different role plays. And in all of those role plays, you would have to act as a medical professional. You would be given advice, it may be to a patient, but it may be to some other non-medical individual, like I mentioned previously. Now, before the role play, the candidate, which will be you will receive a role play card. This card will have the necessary information for you to complete the task that is required of you. The candidate would always play the role of a medical professional, as I mentioned. Role play, essentially, you are in a scenario where you are the medical professional, and you would have to talk to a non-medical individual and explain certain concepts to them. Specifically, you always play the role of the medical professional. Before the role play, you are given a role play card, and you would have all the necessary information that you need to successfully complete the task. Now, when you are given the card, you would have 2 minutes to read and to prepare to execute that task. And so I would state very clearly here, this probably is the best time that you will have, because once you start the role play, you will have to quickly go through the points. This 2 minutes prior to that is where you can prepare to execute a task efficiently and effectively. So please take note. This is a very important point. This 2 minutes is the best opportunity you have to really get ready, because within this 2 minutes, you've been given the questions essentially, and you have to breathe through quickly and then prepare yourself to go through a scenario where you are going to execute those tasks. And so the 2 minutes is very, very crucial. I'll repeat it over and over as we go through this presentation. Now, each role play is 5 minutes long. And so you are given the card, you've got 2 minutes, you prepare, and then you would have 5 minutes to go through an interaction. You have 5 minutes to go through an interaction and then play this role while following the instructions that are given on the card. Now, what does the role play card contain? What is on the role play card? There are 3 essential things on the role play card. Number 1 is the setting. And so, where is this role play going to take place? Is it in a hospital? Is it in a clinic? Is it in a theater? Where exactly is this role play scenario actually going to take place? And so that's very important. The second main point over there is the key background details. What is taking place in this scenario? Are you a doctor, and then you have a patient that has come to you complaining of a migraine? Are you a nurse that is interacting with a patient who just showed up, let's say, at the emergency desk of a hospital? The background, the key background details will give you an idea as to where the scenario is taking place. And then the third key detail on the role play card is the range of tasks that you would have to execute. And so it could be that you have to reassure a patient that the medication that you are prescribing for them has been used several times in the past and it worked for those individuals. And so you are reassuring them that, hey, they will probably get better. And that may be in the case where they may have doubts about the medication. It may be that you are explaining a concept, a medical concept, or you're advising a patient. A range of tasks that you would have to execute, and it is listed in this third portion on the role play card. Now, I'll go through a method that we prescribe for individuals to use during this test, which would really help you to execute the tasks that are on the role play card. The first thing you do when you're handed the card is that you read through the role play card and you prepare your thoughts on the subject matter that is on the card. And so, like I mentioned before, you have 2 minutes to prepare. So during these 2 minutes, you want to read through it and then formulate. You would want to put together your thoughts. You would want to have everything set up in your mind so that as soon as it's time for you to start interacting with the examiner, you can quickly go on to your points, ask the right questions, and then go ahead with a role play scenario. And so please take your time to read through the role play card carefully at this juncture. Whilst you are going through, first of all, you finish going through the questions and then you start the role play scenario with the examiner. Remember, whilst you are going through the process with the examiner, listen carefully to the questions he's asking and respond appropriately. The role play card will give you a list of scenarios, things to go through. And so you are aware of that. How the questions that will be coming with back and forth will be framed by the examiner who is sitting on the other side of you, who will be the patient. Now, that can be framed in different ways. And so even though you have the information, you have a rough idea of what how the conversation is going to go, it's very likely that the examiner may frame them in a certain way, which will require you to approach it in a certain manner. And so please listen carefully to how the examiner frames the questions, how they frame the points as you go back and forth with them in the conversation. You listen carefully to how they frame the questions. They would work their way systematically, and you will also work your way systematically through the tasks and the scenarios that are on the role play card. And we will take a look at an example just to make things clearer. You will have to focus on the instructions that are given on the role play card clearly. Follow those instructions. And then at the end, after you have gone through all the tasks that are listed on the role play card, you will have to pay attention to the time at that point. And so if you go through all the points and you realize that your 5 minutes are not up, a good way to cover the rest of the time is basically just to summarize all that you have gone through previously. Through the previous few minutes, you would have to summarize it and then present it to the examiner or to who is acting as a patient that you are interacting with. And so please take note of that. If, let's say, you're able to run through all the tasks within 4 minutes, you just don't sit down and then look at the face of the examiner who will be acting as a patient or someone that you're interacting with. Please take note of that. If you finish your task ahead of time, use the rest of the time, because that's very important. It's one of the things that you will be examined on. Use the rest of the time to summarize all that you have said previously, summarize it succinctly, and then present it to the patient or whatever role the examiner is playing before you. Now, having gone through these points that you'd have to take note of, I would want to give a quick example just to reiterate points that we went through. So this will just reinforce the things that we have already spoken about. On the screen, you see two boxes. One indicates a role player card, and on it, medicine. This is an example of OET for medicine. That's why we have the medicine written over there. But you have a role player card. You have two role player cards. One is if you come down, you see that one is a doctor, and then the other one is a carer. Now, as mentioned previously, there are 3 important things on the role play card. You have a setting, which in this case is a hospital ward. You have the scenario, which is described over here on top, and then you have a list of tasks. Now you see that there are two cards. On the left is that of the doctor, and as I mentioned in the presentation, you would always be playing the role of a medical professional, and so you would have this card right here given to you, which has the doctor on top. The examiner, in this case, would have the card which has the label of a carer. And so in this scenario that we are playing here, you are the doctor. You are speaking with a son or a daughter of a patient who was admitted yesterday due to unexplained severe swelling of the knee and fever. Test results show that he has a medical condition, Staphylococcus aureus. That's quite a huge medical term. In short, it's a golden staph. It's an infection likely contracted after hernia surgery he underwent 1 week ago at the same hospital. Now that's what you as the doctor you are seeing on your card. The examiner is seeing something similar. If you read what the examiner is seeing, which is under the carer, you are the son or daughter of a patient who was admitted yesterday with unexplained severe swelling of the knee and fever. He also had hernia surgery last week at the same hospital, but was fine after the operation. You are waiting for his test results. So you see that it's something similar, just presented from different perspectives because of the different people viewing it. You have a list of common tasks to go through. Explain the test results, explain possible causes, express your regret about the situation, advise the carer about the first line of treatment, reassure the carer. And so if you look at it carefully, you'll see that you don't need to have medical knowledge of the specific infection that is being discussed here. That is not what you are going to be assessed upon. So please take note. You don't necessarily need to have some medical knowledge prior to the test about the specific infection that is being asked about. If you go through the task, you'll realize it says explain the test results and the effect the infection had on their father. And then it gives you what to say actually. Septic arthritis in the knee causing swelling, endocarditis, and other things. So you just follow that to explain your points. It says explain a possible cause, and then it gives you a cause, very common type of bacteria can enter the body. And so the things that you need to go through this speaking, this role play scenario, the information that you need is provided for you on the role play card. It's provided for you. And so you shouldn't be kind of scared if you see a condition that you are not very familiar with. Now, on the side of the examiner, in this case, the carer, you see that their task is different. They are to ask you about the source of the infection. They'll demand to know how this happened. You believe the hospital did not do their job properly. So that's the role that he's going to be playing. So he may be a little bit antagonistic. Continue to accuse the hospital of being at fault. Demand they treat your father. Ask why he has to be punished by being placed in isolation, even if you can still see your father. And so you can see what is taking place over here. You are the doctor. There are certain tasks that you have to accomplish. But the carer, the one sitting in front of you, they have a task slightly. It's different from your task, but both are supposed to work together to create a conversation for you to have some sort of a discussion around the matter. And so it will tend to be a back and forth between the two of you on the matter. Having gone through the role play cards, I'll quickly play for you an example of how such role play cards, when being acted out, how it may turn out to be. And so this is just an example of how it could be, just so that we have an idea of how such a role play takes place.
The role play will last for about 5 minutes. Don't worry if I stop you when the time is up. Can you start the role play, please?
Mrs. Adams? Hello, I'm Dr. Lee, your father's treating physician. Is this a good time for us to talk?
Hi, Doctor. Yes, absolutely.
Let's sit down. So, your father was admitted here yesterday with severe swelling of his knee and a fever. We immediately conducted a number of tests, and I have the results here that I wanted to discuss with you. All right?
Yes, his fever and the swelling were very sudden. Why does he have those symptoms? What's the problem?
Well, the test results indicate that he has what's called a Staphylococcus aureus infection, which is commonly referred to as a golden staph infection. Have you heard of staph infections?
Vaguely. Is that what's causing his symptoms?
Yes, that's right. The infection has caused septic arthritis in his knee, which resulted in the swelling. Unfortunately, the same infection has also resulted in endocarditis, which is inflammation of the inner surface of the heart, and that's what's caused his fever. Does that all make sense?
Yes, but it sounds very serious. Where did this staph infection come from?
Well, as you know, your father had surgery to repair his hernia last week. We believe that he may have contracted the infection as a result of his operation.
How could this have happened? His hernia operation was straightforward, I was told, and he was fine right after it. I don't get it.
I understand your frustration. I really do. This infection is sometimes caused by a common type of bacteria which is found all around us. It can enter the body through the wound site after surgery, which unfortunately is what seems to have happened in your father's case. Do you understand?
What I understand is that the hospital obviously did not do their job properly.
I see.
I thought an operation room was meant to be a sterile environment.
It is to an extent, but it's impossible to eliminate all bacteria. I assure you that all necessary measures to prevent an infection were taken. I'm very sorry to give you this news, and that your father is facing this situation.
That's not good enough. We're talking about a life-threatening infection in an elderly person. How could the medical staff have been so irresponsible?
I'm sorry you feel that way, and I can see that you're very upset. But please remember that surgery, in fact, any medical procedure, presents a risk. There's simply no guarantee that there won't be any complications, despite all our best efforts. But we will ensure your father gets the best possible care.
Huh.
Do you have any concerns about this?
I just want you to treat him now. What are you planning to do?
Well, the first line of treatment we'd like to start your father on is antibiotics. Most staph infections respond really well to this, so we should see improvements in your father's condition very quickly. Now, one thing I need to let you know is that your father will have to be isolated for the duration of his treatment to protect the other patients.
Isolated? Why does he have to be punished now? What happened was the hospital's fault, and now my father is being punished and I won't be able to visit him?
Oh no, sorry. Of course you'll still be able to see him. We're only isolating him from the other patients in the hospital for their welfare, as they're potentially vulnerable to contracting an infection. But this will not limit your ability to visit him, okay?
Okay, I see.
So we'd like to place your father in isolation and get him started on the antibiotics ASAP. Are you happy for us to go ahead with that?
Well, yes, but I just want to say that I'm still very disappointed about this whole situation, and I'll be putting in a formal complaint to the hospital management.
Of course, you're totally within your rights to complain. Again, I deeply regret that your father suffered this complication after his surgery, but I want you to know that we're taking very good care of him, and I will keep you updated every step of the way.
Thank you. That's the end of the roleplay.
Okay, so this was just an example roleplay of how it will play out. I just want to quickly point out two very important things. First, you realize that as the doctor speaks, he's engaging with the carer, and so he's asking certain leading questions. Do you understand? Is that clear? Like he has certain words that he's putting forth to engage the carer, to engage the carer of the patient in the conversation. And so it's one thing that you will have to pay very much attention to. Just because you have a number of tasks, it doesn't mean that you just run through the tasks and then you keep quiet and then the conversation doesn't go and there's no fluency. It's very important that you engage, in this case, is the carer, but you engage whoever is in front of you with leading words to draw them into the conversation, to encourage them to talk so that it keeps the conversation going. That's very, very important. And it's one of the things that we address at MedCognito when we are teaching this course, leading words that you have to use. These are some of the things that we teach. The second issue is that when I was giving this presentation, I talked about the fact that you don't need to have background information about the disease or the infection that you are going to discuss or whatever, because you'll be getting that information within the test. One thing that we do, one of the things that we will tackle, and we will tackle that in the next webinar, is the scoring criteria for the OET speaking test. And so when we go through that criteria, it will become very clear that you don't need this background knowledge, and that you will not be assessed based on the background knowledge, but rather based on some other important points such as fluency and other things that they will be looking for. And so it's something that we will discuss. In our presentations. I would want to mention the key points that I would want to mention from this presentation that we just had. It's very important, please, very, very important. The 2 minutes of preparation that is given to you, that may be the difference between you being able to perform very well and you being just performing, just okay to pass the exam. And so please take advantage of this 2 minutes of preparation very well. You quickly read through the points that are on the card, the role play card. You think through it, begin to put your thoughts together as to how you think the conversation would go, and then prepare yourself how you would respond for given questions that may be asked. And so please utilize this 2 minutes very carefully. That is your best friend. The second key point is that make sure that when you are done going through the points, if your 5 minutes is not up, you just don't sit down and stare at the face of the examiner. You take your time to summarize the points that you've made previously. You summarize it, you may score some extra points with the examiner. This is the role play that takes place in the speaking test for the OET English test. And so thank you so much, and have a wonderful rest of the day. See you at our next presentation. Bye-bye.